ADEC's Smart Start program offers first-time practice owners their deepest discounts on equipment and furniture for 2 years, plus other savings and complimentary services. Ask your ADEC rep for details and start smart with ADEC. Join Doctors Savanah Craig and Ronnetta Sartor as we navigate life beyond graduation. Real conversations about forging our own paths in our early years in our careers. There's a reason it's called practicing dentistry. All right, everybody, welcome back to a very special episode of Beyond Graduation. This is our first guest appearance ever. So Ronnetta and I are super excited to have Jackie Hassenplug here with us today. So welcome, Jackie.
Thank you, guys. Thanks for having me.
Awesome. So we would love if you would tell us a little bit about yourself, tell the listeners what you do, where you live, and all things.
Yeah, so I am from Chicago, Illinois. I'm about 35 minutes outside the city. I went to Midwestern University. I graduated in 2021. I just opened a practice in December in St. Charles, Illinois. So one of the western suburbs. And I'm a general dentist and pretty much do almost everything. So, yeah.
That's awesome. Congratulations on practice ownership.
Thank you. Thanks. It's been fun so far.
Ups and downs, ebbs and flows.
Yeah.
We joke about it all the time.
Stressful moments, but it's worth it in the end.
That's awesome. So tell us a bit about your journey in dentistry.
Yeah. So I, growing up, had a lot of dental work done. I had impacted canines and was in the ortho chair for 7 years. My first round of ortho, the orthodontist at the time missed that I had impacted canines. So I went through expansion and all this ortho for 3 or 4 years. And then he took everything off, did the final pan, and was like, oh, we got to start all over. And my mom was like, time out. Like, we just finished. What do you mean? So she dragged me to like a million different orthodontists. I'm not kidding. I think it was like 15. And she's like, we're not extracting teeth. Everybody was giving us treatment plans to extract teeth. She's like, no, we're not doing it. Like, find another way. So finally found the orthodontist who finished my case. Was first appointment for the consult. He's like, what do you want to do when you grow up? And I always loved like science and art and stuff like that. And so I always wanted to be in the medical field. And I was like, I'll be a doctor. I don't know. It's like, I think you should be an orthodontist because you're going to be in my chair for a really long time. And that's how it started. At that point forward, I was like, okay, great. Like, let's do ortho. It just stuck with me. And then I kind of like started to do shadowing and stuff like that. And always said, I don't think I want to be a general dentist. I want to do ortho. Then I got to dental school and I was like, oh, ortho might be kind of boring to do all day, every day. And so then I was like, you know what? I went through every specialty in dental school. I was like, I'm going to be pedo. I'm going to be endo. I did apply to endo residency. And then I was in my endo residency interview and I was like, why do I want to do this all the time? And it was like, forget it. I am meant to be a general dentist. That's what I learned through that whole process. So yeah, that's kind of what brought me into dentistry. And I love it. I love every part of it. So it's been fun.
Yeah,
That's
it sounds
awesome.
Like everybody has that moment in dental school. I think as you learn a new thing, you're like, oh, I could do this forever. And then you realize as a general dentist, you can do a little bit of all of it.
Yeah. Well, that's when I kind of realized, because I like doing a lot of cosmetic cases and stuff like that. And so I'm like, I can never do a crown. I can never do a veneer. I can never do like whitening. Like, what do you mean? And
Yeah.
I was like, yeah, no, I don't want to just do root canals all day. I can do root canals when I want.
Yes.
It's great.
I think one of the things, because I didn't have that thought process while in dental school, but once I finished my residency and I started doing a good bit of pros work, I toyed with the idea of going and doing a pros residency. But the thing that I had to realize about it is the cases I'm doing now are fun and I have the option to refer.
Yes.
But when you become the specialist, like you're the last line. So you don't get sometimes you get the fun cases, but you get the more difficult cases for sure.
100%. Yeah. There's cases where I'm like, oh yeah, no, like, that's going to take me way too long. It's going to take him like half the time it takes me. So just go, enjoy, have fun. takes a little bit of the stress out of your day. I don't know how specialists do it. I mean, obviously they have more experience, but it's just definitely stressful for sure. Certain cases, I'm glad I can just say, hey, you know what? I have this guy down the street that I absolutely love. Go there. He'll treat you just like your family here. So
absolutely.
that's nice.
Do you do some ortho? Do you do aligners or dabbling?
I do Invisalign. Yeah, I do Invisalign. I'm in a clear aligner study club. So I do that once a month. And then I do a decent amount of cases. I'd like to do more, but I love my orthodontist I refer to. So
yeah.
I also am like, you know what? Like all kids, I don't touch kids. I'm like,
fair.
You go to him. He can yell at you about not wearing your rubber bands and all that stuff. I like to do more of the simpler cases with adults and like teens.
Totally. So. And then if you don't mind sharing, what happened with your impacted canines? What was the result?
Final result was they were in like the roof of my mouth coming forward towards my anteriors. So they exposed them in the roof of my mouth. They put brackets on, put chains, and dragged them down with another round of expansion. So yeah, that was probably another 3 years of ortho, I think, at that time. So, and then I was the terrible kid who didn't wear my retainers. And so I then put myself back in Invisalign another couple. It was like maybe a month or two just to kind of touch things up here and there. My mom probably wanted to murder me. But
well, it definitely
hide the retainers under the bed.
You did you really?
No.
I was about to say, whoa.
No, I wish. I don't even know what I did with them. I don't remember. I probably tossed them at lunch or something. Who knows? Like every kid does. You know?
Oh, yeah, for sure. Adults, too, throw them away.
Oh, yeah.
One time I tried to use like the spring Holly retainer to move one of my lower teeth, and I definitely threw mine away. So
it's easy to do. That's why I like preach to patients. I'm like, put it in your case. Do not wrap it in a napkin. And sure enough, I'm like, did you? And they're like, yeah, I wrapped it in. It's okay. It happens.
So often.
For sure.
Very nice. Okay, so graduated in 2021. I graduated in 2022. So new-ish grads for the win. And then you opened your practice in 24?
24, yeah.
Okay.
Like, I don't know if we can even count it as 24. It was literally the day after Christmas.
Okay.
So, like, the last week of the year.
Well, that's a great Christmas gift, right?
It was. When I signed my lease and everything, I didn't really calculate, like, oh, we're going to open at Christmas time. So as it got closer, I'm like, oh my God, like, the most stressful time of the year, I'm opening an office. But it actually worked out great because I was able to like have time off of work, my associate office, and was able to organize everything. And my family was able to help me with a lot of stuff that probably in a normal week they couldn't have. And so it was a blessing in disguise.
Well, that's great. So how has practice ownership been treating you besides the ebbs and flows? Is it everything you thought it would be, or?
It is. Yeah. It's nice to be able to walk in and do the dentistry you want to do. Nobody has like any rules on you. Not that I ever practiced in an office like that. I know I have friends that have, but there's always like that little part of you that's like, I wish I had this, or I wish I had that. And so that's like no longer a thing. Like if I want it, I can get it. In reason,
yeah,
to some extent.
Yeah, I think that could be part of the problem too for us too, because it's like, oh yeah, I want that, I'm gonna get that, but will I use it?
Well, that, and then you see the price of things, and you're like, I don't really need that anymore. You're like, that was like a nice want, but like I can wait for a little while.
Business owner brain versus doctor brain,
100%. It does play a role. Like I know I would like ask the owner doc of my associate office, like, can we get, and he's like, that's a want, not a need. And I was like, okay, that's fair. That's very fair. So I'd be like, okay, he'd reel me back in a little bit. He's like, this is not dental school anymore. You don't have every instrument under it. I'm like, yeah, you're right.
Wasn't that lovely though? We could just like hold our hand out, and in dental school, we had it.
Do you remember like the matrix beans of like the Garrisons, and like people would take like a handful of them? And so I taught for a little bit too. So
Oh, cool.
I taught for like, I don't know, 6 months at Midwestern. They asked me to come back. And so it was fun. I was in the clinic, but I would see these kids like take like a handful of the beans and then they'd use like 2 and then they'd toss the rest in the garbage. I'm like, that's like $30 you just threw out.
Yes. Yes.
And they're like, what? And they're like,
Right.
yeah, whatever. So they keep throwing it out. I'm like, well, that's why your tuition's so high.
Hundreds of cotton rolls just to the wind.
Yep.
So I went to Ohio State and we had to like buy our electric hand pieces, which is a whole other thing. But we had like these special cleaners and lubricants and we would just be like, shh, like for 5 minutes. And one of my classmates bought her own practice and uses the hand piece. And she's like, that's $200 a can. Like we were just like, she's like, 1 squirt, you get 1 second. Like they should tell us these things. Like, you know.
I had one faculty that he would do like a PowerPoint presentation like a couple times a year for like his small group of students in his suite. And it was like kind of like a Jeopardy of like, what do you think this costs? And nobody was ever close. No. It was always so comical. And he would be like, can I have your Patterson magazine that you get so I can like look at the prices to like tell them? I'm like, yeah, here, like take my login, you know?
Right.
I mean,
prices change.
Good to know. Yeah, it's good to know like kind of what things are. Because I mean, even just like leaving like the cements uncapped. Oh my, that's my like biggest pet peeve.
A drop of bond.
Yes. Yeah.
Yes. Bond is expensive.
It's crazy.
I was going to say one of the best things in residency, because Savanah and I did the same residency just at different times, was an exercise that one of our program directors made us do where we had like 5 procedures, the most common procedures, and we had to go through and figure out how much everything cost, to figure out what chair time was, how much you were paying people to be there, how much like every cotton roll and glove cost.
Yeah.
And it definitely put things into perspective. It was funny like how it would be wasteful beforehand and then after we did the procedure.
Right.
Not procedure, but that
project.
The study project. Yeah.
That's so funny. Yeah, that would be like they should do that, I feel like, in all schools. Because I think it would cut back on so much waste. And then even too, like it sets it into perspective for when you do graduate, right? Like, okay, now I understand why they were so crazy on me in dental school.
Oh, yeah.
It also gives you a perspective of like why dentistry costs what it costs. Because you're like, all of these things are disposable. And then my assistant that like, just this whole overhead thing I didn't understand until residency.
Yeah, for sure. For sure.
So how did you find your practice? Did you do a startup? Did you do an acquisition? Is it close to where you, how close was it to your associateship?
So it's about 35 minutes away. Okay. I wanted to be far enough away. I live like 2 stoplights away from my current associateship. And he was my childhood dentist growing up. We have a great relationship. The office is fantastic, but it was just time for me to start my own thing. You know, he wasn't ready to retire, and that's okay, right? And so just going and doing my own thing and still having that relationship to be able to still work there while I grow my own practice. So I wanted it to be somewhere a little bit further away and that I could see myself potentially living down the road. So St. Charles it's like kind of like a city feel. Like there's a lot of younger people, but it's like a more affluent area of the suburbs of Chicago. And so it's got a lot of like fun things going on all the time. Like they're always doing fun events. So I wanted something with like more of like an upbeat city feel, but not be in the city. And so I happened to be out to dinner one night with my boyfriend and I was like, hey, look, that's available. And we were looking with my broker. I was working with Carr and they were fantastic to work with. And so they just kind of helped guide me through that process. I was like, hey, can you look at this one? And he's like, yeah, sure. And it all just fell into place. So it's been cool.
Very good.
Yeah.
So what made you decide to do a startup versus an acquisition?
So I went down both paths. I was talking with my current doctor about potentially buying his practice. I went and talked with like, I don't know, maybe 10, 15 other doctors. And it was either I was going to buy my associate office or none of these other offices felt right. It didn't feel like me. It didn't feel like I was doing the dentistry that I wanted to do day one. I'd have to completely change like the processes and everything. Like my associate office is very well ran. He has like this structure, and he had a consultant come in years ago. And so everything is like for a reason of why we do things. And these other offices, I'd walk in and I was like, I want to pull my hair out just being here for like 30 minutes. So I was like, you know what? It's either that or I just do my own thing. And so it ended up working out. I did my own thing. I'm like, I put those same processes that he has in place to be very structured and to have a system for everything we do.
Very cool. Tell us some of your favorite systems. I think this stuff is super interesting. And at Ignite, we're very focused on the peoples, the processes, the systems, and how those all actually make a practice run and not be stressful and crazy. So we would love to hear what some of those things look like for you.
I would say one big one is just like a morning huddle every day.
Okay.
It just gets everybody on the same page, right? Like, okay, whatever happened yesterday. If there were things that like didn't go great yesterday, let's talk about it so we can improve, right? And always look at like how we can keep bettering ourselves, but also like what went really well yesterday and that we want to continue doing. Maybe we figured something out that we haven't been doing and maybe we want to keep on that, or we've been working on something and it finally clicked, right? And then talking about our schedule for the day, right? So kind of going in and, front desk looking at like, is there any outstanding balances or things of that sort? Is there a recall scheduled? Is all of that information, like making sure that front side of things is being taken care of, but then also the back, seeing, okay, are these codes attached properly? Are they the right surfaces? Is it even the right tooth? Is there in the treatment plan multiple of these codes? Do we need to delete something? Have we already done something? Are we going to run behind on a procedure? And like, hey, can someone seat my next patient for me because this procedure might take a little bit longer than expected? And then same thing with hygiene, like they do the same thing. So just having that structure in place to really talk about and like walk through your day together to then have a more successful day. Because if everybody's just running on their own time and own schedule, it becomes a little bit more chaotic. So being able to kind of talk through that's always nice. That's probably my favorite one, but I have a million more.
Well, it's interesting that it's something that's so small, but it sets you up for success every day.
It does every day. And that's what, like, even like if there's like one person saying like, oh, my kid ran late for school today and I got to take them, they missed the bus or whatever, it happens. Like there's not a perfect day every day, right? But even just that one person missing in that huddle, you're like, okay, someone else needs to look at their schedule and like hope this is like what they're thinking in their head, right? Because they're the ones running that schedule for the day. So you got to kind of play that into account. And so it makes a huge difference in how the day kind of flows. And, if somebody's out sick or whatever, how are we going to jump in to help cover for that person? So it's just like our one meeting time. And we do a monthly meeting every month too. So having that to just kind of say what went well this month, what didn't go well, and kind of fine tune everything and have, my staff bring things to the table and say, what if we did X, Y, and Z? Okay, great. How are we going to implement it? Let's try it. Let's put it into place. Because sometimes, I don't have all the answers, right? As doctors, we don't know every little thing. And maybe somebody's bringing something from another office that works fantastic too. And then we can go back next month and say, did we like how that ran? Did we not? And go from there.
Thank you for joining us for this episode of Beyond Graduation. If you enjoyed this week's episode, be sure to share it with a friend. Connect with us on social media at Savanah Craig DDS and at Dr._Sartor. And remember, you are not alone on this journey.
ADEC certified pre-owned equipment is a sustainable, affordable choice that makes genuine ADEC equipment available to every doctor. Each package is sold on a first-come, first-served basis. So, if you see one you like, contact your dealer. For more information, go to www.adac.com/find-a-dealer. Thank you for listening to Beyond Graduation, brought to you by Ignite DDS and Future Dentists. This episode was sponsored by Ignite DDS Coaching. We build self-determined futures. For more information, please reach out to the Ignite DDS team.